And so, ladies and gentlemen, as I've been saying, the COVID situation in Ghana has now become very, very some way. As a matter of fact, you can't even find a word to describe it. And then this evening, we want to go into depth of it. We want to ask questions. We want to speak to people who have been in the situation in Ghana and then who have experienced the system over there so that we will be able to give you the answers that we are waiting for. So I am still waiting to connect Dr. Wright, and then we would put the questions to him since he's the man who is on board. He's the man who is actually, he's the man who is on the grounds to tell us what is actually going on in Africa, Ghana. And if you want to travel at any time, hello, doctor.
Yes, sorry about that. We have a little situation with the network. Yes. Yeah. So as I was saying, in Ghana, the COVID situation, really, the government has actually done well, and we are all doing our part, our possible best to actually keep the COVID situation under control. And currently, our active cases stands at 1,781. And we have over 100,000 cases now, and then over more than 1,500 deaths have been recorded. But we are keeping on. And I must confess that actually in Africa, Ghana is actually doing well in terms of its control with this COVID thing that is happening all over the world. Yes.
So what is the government doing that the others are not doing, that it seems that Ghana is doing well?
Yes, I must say that from the onset of this whole COVID thing, the government was ahead of, should I say, the virus, the SARS-CoV-2 virus. The government was actually ahead of it. So the lockdown happening last year in May, April, we're closing down our borders on time. Contact tracing, able to, all those things were all factored in. And we building more hospitals, providing the treatment, all those things were all done naturally to keep the COVID-19 under control. And I must say that was something that actually helped the country as a whole, especially with the lockdown. Yes, it was the COVID cases was skyrocketing. If I could remember, in April, May, thereabouts. So the president had to come in to execute some executive orders, where the lockdown. So the lockdown actually brought up everything under control. And aside that, the health professionals also did their best in terms of contact tracing here and there. Once we discovered that, okay, this person has been infected with the virus, we had to do contact tracing, something called contact tracing, getting to know the last person that the person met. So that is what we were doing, and by the grace of the Almighty, we have been able to put the COVID under control. Yes, even though we have lost one or two, about over 1,000 lives, but I think we've actually done our best to actually keep the COVID-19 virus under control. Yes.
Wow. Doing your best to keep the COVID-19 under control. How will you say that the pandemic has affected foreign travel?
Well, it has greatly affected foreign travel.
Okay.
Last year I needed to attend a conference, a very important conference in Washington, and I could not attend because the borders were closed. Yes, and I had to miss that particular conference, which was so dear to my heart. You understand? So it's actually, oh yes, so actually it actually affected a lot of things, and I must confess, this year, it was just announced by the Minister for the Tourism that we'll be expecting over 150,000 tourists. That was this year. And I think revenue, which was last year, I think the government of Ghana made about 5.5, last 2 years, a year before the COVID lockdown, about $5.5 billion or so. I don't know whether it's a billion, $4 to $5 billion. So that was last 2 years where we had
year of return.
What's the name? Yes, the year of return. So much we were anticipating more in the following year, and then COVID just hit us. Okay, and all of a sudden everything started crumbling down. But recently, well, we started picking up, and tourists are trooping into the country, and then we are headed. So it actually affected travel greatly. Yes, and I'm a victim of that. Yes.
Wow.
So it actually affected it. Yes, families, people. Yes, it's really affected it. Yes. So
ladies and gentlemen, Dr. Wright.
The way you ask a question is an statement. It's really, really
Ladies and gentlemen, Dr. Wright is a medical journalist. He is one of the specialists in the Kolegu Teaching Hospital, and then he is also on the ground for COVID-19. And then if you are watching us on Facebook, we've just had Mr. Opare coming in online from Ghana, and then he will be joining the conversation. Hello, Mr. Opare. Good evening.
Good evening, Patrick. How are you?
I'm fine, thank you, sir. I'm fine, thank you, sir. Thank you for joining.
And no worries, no worries.
Yeah. So, ladies and gentlemen, I will continue with the conversation, and I have been having questions from Ghana pertaining to the travel aspect of the COVID in Ghana, and then someone actually texted me from Ghana just this evening complaining about the services in Ghana, as how people don't get information. We will get there, but I want to ask Dr. Wright about the rationale behind some of the things that is being done at the Kotoka International Airport. We realize that people would come from outside the country, and then I don't want to talk about the charges because I know, Dr. Wright, you are not part of the committee that decide that. But I want to ask this question, that what is the plan for families? What is the plan for the elderly? What is the plan for children when it comes to the COVID assessment at the Kotoka International Airport?
Okay, it's a good question. And well, so far, from what we have from the, according to what we have from the Ministry of Health and the Ghana Health Service. Hello, Patrick, can you hear me?
Yes, I can hear you, sir.
Hello, Patrick, can you hear me?
Yes, I can hear you.
Yes, so what we have is that for the, okay, so your question, yes, so what we do currently at the Kotoka International Airport, I can just give you something brief about that. And as I told you, I'm not a spokesperson for the company itself.
Yes.
Yeah, but I'm one of the workers there. So let's take it like that. So what we do is that when we have elderly, okay, normally every country has a specific protocol that they follow. Okay, when you enter or when you travel to any country, every country has a specific COVID protocol that the any tourist or anybody coming in, whether the country citizens or anybody, must follow, and it is mandatory. Okay, some countries will be there, something like the US. You go in, once you are vaccinated, you are allowed to go. Some of them even like Dubai, once you are vaccinated, you've done your COVID PCR test, and you are not allowed to be tested and all that. But in Nigeria, for instance, someone just came back from last week. Once you have the COVID-19 PCR, so every country has a specific protocol that they follow.
Okay, ladies and gentlemen, it looks like Dr. Wright cut off. So, Mr. Opare, good evening again. I know you've just got into Ghana from the United Kingdom. Can you tell us your experience at the Kotoka International Airport when you got there?
Oh, hi guys. First of all, I'd like to apologize for not showing my face. It's just I'm in a car and it's quite dark, and I don't want to.
That's okay.
So I don't want to be rude. So I do apologize for that. So But when I get somewhere where it's quite light, I will show my face. Now, my experience at the Kotoka International Airport, and I'd like to say that
yes,
can you hear me?
Yes, I think I'm back now.
Yes, you are back. You are back. But at the moment, I think Mr. Opare was giving us his experience. Okay. So I'll just make him come before you come in.
No problem. No problem.
All right. Thank you very much, Patrick. My experience at Kotoka International Airport is that of I'll say it's good in the sense that I knew what I knew that I had to pay. If I'm traveling with my Ghana passport, I have to pay $50 at the airport to get tested. Okay. You know, and I knew what I was going into. And when I got to the Kotoka International Airport, I must actually commend the health staff at the airport. They are amazing. You know, they just check you in, you go and get your test done. And by the time you come out the other way and get your baggage sorted, the test is back. And it was quite smooth. I've been in this country 3 times this year already. It's my 3rd time here. And all 3 times it's been really smooth, no problems. And I've actually said to my friends back in the UK that, look, it feels even smoother here than it is in the UK. The only difference is that you have to pay for this thing anytime you come in and all that. But it's the same with the UK in a way. You don't get tested at the airport, but you have to pay all that money to do your day 2, day 8 test and all that. And, you know, so yeah, I think the Ghana Health Authority, they're doing a great job. I must commend them. Yeah, that's my experience.
Wow. It is quite heartwarming to hear that Ghana, you know, is doing all these things. God bless you. Doctor.
Yeah.
Hello, doctor.
Yes, I can hear. I can hear you.
Yes, please. So let's go back to your explanation.
Yes. So as my honorable brother was saying, we are doing our best, and we have a lot of complaints and all that, and we are trying to improve upon it. As I said, early when they come, we have a specific protocol for them to follow. We also have those that are disabled or probably cannot work. We also have a specific protocol for them to follow. But in all this protocol, we have to take the sample. That one is key. We have to test you, okay?
Of course.
And then with the protocol, with the current protocol that we have been given, children that are less than 5, okay, are being exempted. But then we've taken it. The Ghana Health Service and the Ministry of Health are still reviewing these policies and documentation that the policies and the protocols that we are using at the airport. Okay, so everybody is involved. Okay, but the point of the matter is we are doing our best, and yes, we are doing our best to make sure that the country is safe. Okay, that is what I want to tell Ghanaian citizens or any tourists who wants to come to Ghana, that we are doing our best. They shouldn't fight with us, but we are trying to do our best to make sure that our country is safe. And I must say that we are doing a wonderful job. Let me blow my own horn. We are doing a wonderful
please,
job.
blow your horn, blow your horn.
Okay. Yeah. So that is. So that is what we have been doing ever since the start.
So thank you very much. I will go to Mr. Opare. Mr. Opare, you've been in radio for a long time, and in the UK, I know you are in radio. There was a lot of news going on that when you get to the airport, I want us to clear this for my listeners, that when you get to the airport, sometimes you will be given a positive test when you are negative, so that you pay to stay in the hotel before anything. Then they will get money out of it, which means there was some fraudulent activities going on. Did you experience anything like that?
What I'd like to say is that, I mean, people are saying these things, but to be very honest with you, I've never experienced it. I don't know anybody who's ever experienced it. I don't have a first-hand or second-hand experience of this thing. So I'm not going to say that it is true. As far as I know, when you get to Kotoka International Airport, you get tested, you get your result. If it's positive, they take whatever precaution or action they have to take. If it's negative, you just get your bags and you go away. That's as far as I know. I haven't seen anybody complaining at Kotoka Airport, never, ever. And this year I've been to Ghana 3 times, as I said earlier on, and I haven't seen that. So I don't know where that is coming from. I mean, I've seen it on WhatsApp, people saying stuff like that. But that is as far as I know. I guess it's what I've seen on WhatsApp and on social media. But I haven't seen anybody do it. And I have never experienced it. So yeah, that's my point.
So from what you are saying, it's a smooth ride, isn't it?
Well, for me, yeah, it's always been a smooth ride. I've never had any problems in Ghana at all. Especially at the airport with COVID or anything. I just, go through there. I get my test done. I get my results, and it's always negative. I pick my bags and I'm out. And I look around. I don't see anybody being hustled or anybody being, for the lack of a better word, molested or saying that, you have positive when the person has negative. I haven't seen it. So, yeah, I haven't seen it. So, yeah.
Thank you very much. So, Doctor, let me come back to you. Concerning the hotel quarantine, what are the rules for someone to be told that, okay, you are positive, so you're going to quarantine you in a hotel, in a government-approved hotel? What are the rules that govern that policy?
Hello, okay, so you see, I want to say something about what my brother said. We've heard a lot of things going around on WhatsApp. Can you hear me?
Yes.
Can you hear me?
Yes.
So we have a lot of things going on WhatsApp concerning we giving out positive results and all that, but it's not true. We are professionals that are working at the airport. When I say professionals, I mean professionals, and we know what we are about. It is just a little bit of miscommunication. Sometimes some of the passengers or our clients need to be educated. People think once they test negative when they are their country of departure, when they get to Ghana, within some hours, they're supposed to test negative. But that is not how the virus works. That is not how the SARS-CoV-2 virus works. Okay, as the name goes, it's novel coronavirus. This is a new virus that we are still understanding. So sometimes CDC may say something, this is how it is, but later on CDC will change, okay, that this is not how this virus is. This is novel. We are still studying what the virus can do and what the virus cannot do. Okay, so when I don't want to go into details about the virological nature of the virus, but you can test negative from your country of departure, and you can come to Ghana and then you test positive with it. Okay, so it doesn't. It's not like we are giving out forcing positive results to people. We are professionals. We are professionals doing our professional work. Okay, so we know what we are about. And then to answer your question about the hostel facilities, I think, hello, Pat, can you hear me?
Yes, I can hear you.
Hello, can you hear me?
Yes, I can hear you. It's a little bit delayed, but I can hear you.
Hello? Hello?
Yeah, I can hear you clearly. Hello, Doctor.
Hello, Patrick, can you hear me?
Yes, I can hear you. I think we are having a little bit of issues.
Hello?
Yes, Doctor, I can hear you. Hello? Okay, ladies and gentlemen, I think the internet services of the doctor is not being stable. So I would continue with the conversation with Mr. Opare. I know Mr. Opare has to go on another show, but I will keep him for a little bit and then we would continue from there. Mr. Opare, so all your 3 times going to Ghana this year, was there a very long queue at the Kotoka International Airport?
Long queue for what? For the COVID test?
Yes.
No. It's just it's just like, it depends on how many people are coming out of the plane. Once you come out of the plane, there's a very orderly queue. So you just go, you get to the health authorities. They take your they scan your barcode, and then you go into the cubicle. You get the things, inserted in your nose or whatever, and then that's it. And then you just go. It's not fault the health authorities in any way. I think they're doing a brilliant job. They're orderly, they're professional. There's no wuru-wuru anywhere. You just go, you do your thing, and you go. And then you get your results, and you pick your bags, and you go home.
So, Mr. Opare,
yeah. There are no queues. Yes.
What are some of the certificates that you had to get? So, assuming someone wants to travel to Ghana and then has never been to Ghana since COVID started, what are some of the things that the person needs to do? What are some of the tests the person needs to have before getting to the airport? And when he or she gets to the airport, what are the processes to go through that you have been through that you can explain to us?
In Ghana, the Ghana authorities demand a pre-flight PCR test from wherever you're coming from.
Okay.
So they don't decide on how much you're going to be charged for the you're in. That decides how much you're going to get charged. But what they need is a pre-flight PCR COVID test. So you show that at the airport before you're allowed onto the flight. All the airlines know that. That is number one. And the other thing they demand is that when you get to Ghana, at the point of entry, you get an antigen COVID test.
Yeah.
Okay. These are the two things that Ghana demands from anybody who's traveling into Ghana. And I think I heard saying something about the fact that
Hello, Mr. Opare.
Yeah, Patrick, I'm back. He's also
okay. Okay. So I think we would go back to Doctor. Doctor, we were talking about some of the requirements that someone would need. So assuming someone hasn't traveled to Ghana since COVID started, and then the person is coming.
So those are the two tests that we need.
Yeah, I think we are having troubles with Mr. Opare's audio.
The network is a bit shaky over here.
Yes.
Yes. Can you hear me?
So yes, I can hear you.
So when someone wants to travel to Ghana, what the person is, if you have a Ghanaian passport, a Ghanaian passport or any of the ECOWAS countries, their passport, you are supposed to pay $50 for the test.
Oh.
Okay. A non-Ghanaian, $50. So a non-Ghanaian or ECOWAS passport, you pay $150. Okay. That is, in fact, the prices were reviewed this year. At first, it was $150 for all, but the government had to review the prices down to $50 for Ghanaian and ECOWAS holders, passport holders.
Okay.
So that is how the whole thing. And about the hotel, so what happens is that when you test positive in Ghana, okay, at the airport, you are being taken. So probably they will come to you, the port health, and then they will advise you, they will tell you the result, and then they will tell you that if you have any family member around, okay, who you would like to inform. Okay, so they will tell you, okay, I have someone is waiting for me outside to take me home. Okay, then you call that person and inform that person. And then what we do is that we have several hotels, okay, which we quarantine these we quarantine our clients. Okay, so let's say if we have many options, the government holding facilities are few. Okay, so if, as I'm talking to you right now, we have about 1,500 active cases. So let's say if all these 1,500 active cases, probably they've occupied the government holding facilities, something like the Ghana East, UGMC, they've occupied it. So it means that we now have the other hotels which are available So we would then tell the client, our client, that is the passenger or the traveler, that okay, we have McDad, we have this Kempinski hotel, we have these hotels available, and then these are the costs attached to these hotels. So you will then tell us your preferred hotel that you want to go to. Okay, if you tell us, okay, I want to go to Kempinski, okay, and then we go to Kempinski, and then we found out that Kempinski is full. Then we tell you that, okay, Kempinski is full, so you need to choose another hotel for you to be quarantined. Okay, we are doing all of this. You can go home and quarantine and all that. It won't spoil anything, but we are doing all of it because of the experience that we've had with some passengers or with some travelers. Okay, that is why we are doing, or we want, that's what I'm saying, that every country has its protocol. Okay, in the UK, you pay for your hotel. I don't know how it's done there, but what I've heard is you pay with your hotel, whatever you stay for the quarantine, you pay, and do the same. After you've done the test, you wait in the hotel and pay for it. In Dubai, you wait then you pay for it. So all this, each country has its own protocols that they follow. Okay, so this is what we do pertaining with the hostel. Once you test positive, pertaining all that, that's what we do in Ghana.
Wow. Ladies and gentlemen, so it is not that people would intentionally force you to be in a hotel, or they would dump you somewhere, and then you just be there without being taken care of. But this is a formal policy that they go with, they use in order to curb this whole pandemic. So, doctor, the cost of the hotel, is it borne by the government or the traveler?
Initially, when the COVID pandemic started, it was borne by the government. But a review was done. Your hotel, where you will stay, you are supposed to borne the cost of it. That is it. With the government holding facilities. Except with the government holding facilities. If those facilities are full, then you go to any hotel, then you need the cost of that particular, the duration of your stay, you have to pay for it. Okay, and sometimes when you stay there after 3 days, we do the test, and then if you are negative, you let you go. If you are positive, but you still undergo, you'll still be treated. Okay, so that is what we do. But if you are lucky, you get to the government holding facilities. It's free, you don't pay. So that is how, and we have some passengers who come to Ghana and they prefer to be in a hotel other than the government holding facilities. We have such group of people, yes. So it depends on the person's choice. I don't think someone was forced to be in a hotel that he or she doesn't want to be. So that is how the thing is. Yeah.
Wow. Ladies and gentlemen, you are on Patmark Radio UK. My name is Patrick, and this is Live Stream. We are talking about the impact of COVID-19 on foreign travel in Ghana. We are concentrating on Ghana because the laws affect the whole of Africa. And then from what I have been hearing from the experts on the ground, if you are having a Ghanaian passport or an ECOWAS passport, you don't have to pay that much. It is just $50. And then your test will be conducted for you. Doctor, please, what are the dissemination of information like? Because this evening, I had an information from Ghana like an hour ago where someone is traveling to the UK, but was not aware because the person is fully vaccinated. And then this man was not aware that he was supposed to download his QR code. So when he got there, he had to incur an extra cost before he could pass through, before he could join his airline. But this man is fully vaccinated. What are the plans for passengers to get information quickly in order to avoid such situations? I think the doctor is gone again. Mr. Opare. Hello, Mr.
Yes,
Opare.
sir. Can you hear me?
Yes, sir. Your line went dead. Oh, yeah.
Yes, it did. Oh, you know MTN.
I understand.
I'm going home now, so I connect to the Wi-Fi, so it will be better.
Okay. Oh, okay. So before you get home, if you have been fully vaccinated and then you are going outside the country, what are the protocols like as compared to someone who is not fully vaccinated?
Sorry, were you to me?
Yes, sir. Yes, sir.
Hello?
Yes, sir, Mr. Perry.
Sorry, can you repeat the question?
Yes, I was asking that.
Repeat the question, please.
Yeah, what are the protocols for travelers who are fully vaccinated, who are traveling outside the UK, and then I mean, as compared to those who haven't received any vaccinations at all?
Well, if you are fully vaccinated and you're traveling outside the UK, and you're going to
Hello, Mr. Perry.
The antigen test at the airport. But on your way back to the UK, because you are fully vaccinated, the United Kingdom government does not demand that you do a pre-flight COVID test from the country that you're coming, like from Ghana, for example. But when you get to the UK, you are obliged to do a day 2 test. But this time around, fortunately, you don't have to necessarily do a PCR test. You can do an antigen test or a lateral flow test on day 2. If you are negative, that's end of story. And then I would also like to add that you are not obliged to quarantine for 10 days. You just if you're working, you can start work the next day. But in the case of testing positive, then you have to, by law, you have to quarantine for 10 days. And if you're coming from a red zone country, you have to take a pre-flight COVID test, and then you have to quarantine for 10 days in a hotel. You have to pay for it. And I like to say that I don't see the fuss in a lot of Ghanaians talking about the fact that when you come here and you are positive, you have to stay in this hotel and pay for it. Well, I do understand it. Sometimes you don't have the money, but in a way, if you compare to UK, it's way worse in the UK. You pay much more, over £2,000, and you're forced to do that. You don't have a choice. You have to go into a government-approved hotel and then pay for it. So I mean, you have to weigh your options. If you know that you're going to a red zone country and this is what you're going to face when you come back, as difficult as it is. Sometimes you'll have to just decide that I'm not going to go. Otherwise, you know the consequences. You have to pay for.
Of course.
Yeah.
Of course. So, Mr. Opare, before I let you
Patrick?
go, yes, I can hear you. So, Mr. Opare, before I let you go, when you are traveling from UK, Ghana, up and down, did you see any plan for the elderly and then the sick when it comes to the protocols?
Yeah, I can only talk for Ghana. I can only talk I can talk for the UK as well. The elderly, they're always given priority, as probably in most countries, because they are elderly. So they have to put them in front of the queue or whatever. And so would they do for children, because children are quite vulnerable, aren't they?
Yeah.
It's the same in Ghana. I mean, when I arrived last Saturday at the airport, we had about 5 or 6 wheelchairs taking the elderly from the plane and taking them all the way down. And some of them, it's not necessarily because they can't walk, but they're old people, so they can't do what you and I probably will do. So yeah, there is this provision for the elderly and children as well. They are always a priority. They make sure that they're in front of the queue. They get what they have to get, and then they are dispatched quite quickly. Yeah.
Wow. So thank you, Mr. Opare. I will come to Dr. Wright. Doctor, I wanted to...
Sorry about that.
Yeah, I think you...
Can you hear me now?
Yes. Doctor, we were talking about a report that I had from the KIA this evening, and then you were trying to address that issue. Are you aware of the demand for QR code at the Kotoka International Airport when people are fully vaccinated?
I'm not aware. Normally, for now, we don't have a policy in place that states that when you are fully vaccinated, you are not supposed to be tested. Okay? We don't have a policy like that. So whether you are vaccinated or not, once you get to Ghana, we have to do the test. And as I said, you getting vaccinated doesn't mean that you'll not be infected with it. It just gives you a temporary protection. Okay? So I've not heard anything of that sort. Once you are vaccinated or not, once you come to Ghana, you have to go through the test. Yes.
So what happens to this man who was traveling from Ghana to the UK, and they demanded to see a QR code?
Yes. So yes, it's true. So right now, there is a system. We found out that we are getting people are coming in with fake positive result, fake PCR results. Okay. So in order to cut down, all of these things, we decided to. So a platform was created. Okay, which all the centers that are doing the COVID-19 testing in Ghana, okay, we're all accredited by the Food and Drugs Authority and then the Ghana Standard Authority. Okay, so all these people, we have a platform that they have been put over there. So anybody that is traveling outside Ghana, okay, if you do your test at Noguchi, there is a particular QR code which will be imprinted on your result slip. Okay, so per the airline, which airline that you are going to, when you get there, it will be scanned to really confirm that this particular test was done at this particular facility. Okay, not done in any other facility. So those are some of the checks that the government has actually, or the Ministry of Health and the Ghana Health Service has actually put in place to cut down the rate at which positive or others, people bringing fake results and other things are coming, and it's actually working. It's actually working. So that is all about these QR codes and things. Yes.
But this man has actually been fully vaccinated in the UK and had a passport.
I was also fully vaccinated. I had to do the test. It doesn't really matter.
Okay.
It doesn't really.
So,
but they are still reviewing the document. I don't know when it will come out. So let's pray. Wow. In the UK, for instance, you have about 90% of the entire population have been vaccinated. Correct? So in the US too, the same thing. But in Ghana, we only about 3 million. 3 million and about 100,000 people have been vaccinated. Okay, so we've not actually achieved that kind of herd immunity or something. Probably in order to achieve that. So we can't also let our guards down. So it doesn't really matter. We are now advocating for people, educating people about this, about vaccinations, trying to tell them about these conspiracies about vaccinations and all that. And we're actually getting more people to be vaccinated. Yeah, so that is it.
Wow. Doctor, Our time is almost up, but I would ask this last question that as an expert on the ground, as an expert on the ground, what is your advice to travelers, those coming in and go out? What should they keep in mind?
I have a lot of things to say, but as I told you, sometimes I'm very careful of my words because I'm not a spokesperson at Frontiers or at the Kotoka International Airport. But what I want to say is that my dear brothers and sisters out there, and any other tourist that is coming, when you come into the airport, we have a particular protocol, a procedure that we follow. And as I always tell the passengers or the travelers, every country has 8 protocols, okay? So when you are traveling to Ghana, it is best for you to call either your airline, whether KLM, British Airways, you have to call them to find out what are the new policies that are being put in place, okay? Let's say if I'm going to Dubai, I have to make sure I get so that I don't get stranded when I get to Dubai and they tell me that, oh, I have to do this test and I wasn't prepared or I don't have any money on me, okay? So I would advise people that when you are coming to the country, just a phone call, find out, get all the clarification that you need before you set out to travel. And when you come down here and we are doing the test, we are professionals also here. You know what we are doing. Okay, it's not that we don't know what we are doing. We know what we are doing. We were put there to work. Okay, we were put there to work. We didn't make say the government should charge $150 or $50. About the costing or about that one is not our problem. But we are serving our country. We are protecting our country. Okay, so sometimes you hear people say, why are you guys taking a lot of money? Why is this? But that is not why I am there. I was not part of the decision makers to actually take that money. Okay, so I will just entreat all our travelers that they should keep calm once they get to Ghana. And they should, yes, we are all doing well. By God's grace, everything is doing well. And until we hear otherwise from the Ministry of Health or the Ghana Health Service, the testing still goes on. Yes, so that is all that I will say.
Thank you very much, Dr. Wright. Thank you very much. I would go to Mr. Opare to give his advice as a traveler who has been going up and down Ghana and London. Mr. Opare, what would be your advice to the traveling Ghanaian or the traveling African, the traveling tourist, let me put it that way, who is going and coming? What would be your advice as per what they must know before they get to the airport?
Well, I'll say there's not much I want to add to what the doctor has said. The fact is that whenever you're traveling to any destination, even when the COVID situation was not, around, whenever you're traveling to any destination, you check and see, you check and ask around, call the embassy, call the airline, ask what are the conditions, what should I have, what shouldn't I do when I go to this country and all that. It's a normal thing. Now COVID is upon us, and we know that the certain countries demand certain tests and certain procedures and all that. And like the doctor said, every country has its own procedures. What you probably will face when you're going to Dubai might not be the same thing when you're going to Nigeria. So just ask. It's as simple as that. Just ask around, ask. And there's plenty, absolutely plenty of information out there on websites, on government websites, on airline websites, on a health website, everywhere. Just check and see, I'm going to Ghana. What do I need? So you prepare yourself. By the time so you don't get caught, by surprise, or you don't get caught in a certain web. Prepare yourself, for example, that when you're coming to Ghana, just assume that in case I test positive, what am I supposed to do? I'm supposed to pay for hotel, this and that.
Yeah.
So at least prepare yourself. Like the doctor said again, these guys are professionals. I mean, 3 times I've been to this country this year. I have never had one single problem with these people. The professionalism is there for you to see. As soon as you get to Kotoka International Airport, the way they welcome you, the way they go, they lead you through the procedure. You go, you get. It's simple, very very simple. So if you allow yourself to be led by them, as it were, everything goes simple. So yeah, that is my advice. research before you travel. Thank you.
Wow. Ladies and gentlemen, Mr. Opoku Opare is a radio broadcaster, and he's been in the system, in the radio business for a long time. So if he says this is how it is, believe me, he's right. Thank you very much, Mr. Opoku Opare. Thank you very much, Dr. Wright. And we really appreciate your time. We really appreciate your time today.
Thank you, you too.
Thank you so much. Ladies and gentlemen, our time is up. And then this has been Live Train. My name is Patrick, and then you are on Patmark Radio UK. You can follow us on Facebook, Twitter, Instagram, and on YouTube. When you type Patmark Radio UK or Patmark Records, you would find us. Subscribe to our channel, and then you can revisit every conversation that we have had. We will be with you again next week. And then next week, we are bringing the doctor, the medical doctor back, and we are going to talk about diabetes. So if you are listening to me and then you want to hear more about diabetes, how to treat yourself, how to take care of yourself, ladies and gentlemen, you can join us next week, and then we would have that conversation for you. This conversation is going to be on YouTube, it's going to be on Facebook. You can catch up at any time, and then you wouldn't find yourself wanting whenever you want to travel. This is Patmark Radio UK. My name is Patrick, and then you are with Live Train. Next week, exactly this time, you are going to hear from us again. Stay blessed and stay tuned. Bye. Hello, doctor.
Hello, Patrick.
Your internet worked at last.
Yeah, so I was using
we thank God.
And luckily, I had a lady friend beside me, so she wanted us change to Vodafone. So that's
yes, I can. So Vodafone is very good in Ghana.
Vodafone.
I can see Miss London Bridge. Thank you for me.
Okay, I will.
Thank you very much. I can hear you are driving home. I will leave you so that Yele told me you guys have contacted, so you have plans for the week.
Yes. So okay. Thursday I'll be meeting her to go and do the Ghana card, and then we'll be looking at some properties around the same area.
Okay. Thank you very much. Doctor. Hello.
Yeah.